Hello students, today we are going to do a new sense organ, that is our sense of hearing, and the hearing sense can be performed with the help of our organ. Like we do have ear from external surface, and inside we do have different parts like external ear, middle ear and internal ear, and these perform various sense or regulations, like which sensation of the hearing or the equilibrium. So different parts of ear are responsible for that. So just let me share my screen in full screen, so we can hear some sounds are loud and some are quiet sounds. Okay, so all these we are able to discriminate with the help of our sense of hearing, and also we are able to balance our posture, and we are not going to fall whenever there is some thirst. We take care of ourselves and balance our posture and our control our speed. All this equilibrium and balance and hearing, the sensations are being taken care by our ear. And the structure of ear is, there is three divisions: external ear, middle ear and internal ear. So what we look from the external surface is a part of the external ear, that is we can just see auricle or pinna here, and then we can just have the external opening of the external auditory canal. So we can just see the auricle or pinna and the opening of the external auditory canal. And then this external auditory canal is a canal like structure, and it opens inside towards the middle ear, which is located into the bone, the temporal bone. So auricular part is made up of there is skin underlying which there is cartilage. So this much part is cartilaginous, and the inner 1/3 part is actually 2/3 part is the bony part, which is made up of the temporal bone. So whenever you look at the skull, you must have seen the bony part of the external auditory canal, this opens in towards the middle ear, and there is a separation or a membrane which is called as tympanic membrane between the external ear and the middle ear. And in the middle ear, you can see there are some small bones which are present. These are called as ossicles, and there are three ossicles: malleus, incus and stapes, which are present inside the cavity of the middle ear. And then you can see this stapes is attached with another structure, like its footplate is being attached at the oval window towards the inner ear. So this part of the ear within the bony cavity, which is called as the inner ear, which has these canal-like structures which are projected at right angles to each other. One is vertical, one is horizontal, and one is horizontal in another plane. So these are three canals. Three of them are oriented in a 90 degree to each other in 3 dimensions. And you can also see a spiral-like thing, which is like a snail-like thing, which is present over here, and this is called as cochlea. So what you can see in this diagram is the bony part of this. Means the bone has differentiated to form these semicircular canals, and this spiral thing, the cochlear duct, and these are the semicircular ducts basically. And into these ducts there lies the membranous structures of the semicircular canal and the cochlea. So that is the inner part, the membranous labyrinth, and this outer part made up of bone are called as the bony labyrinths. So it is these bony labyrinths which are forming a part of the like they are a house. They are housing some soft, delicate membranous structures responsible for hearing and for equilibrium. So those delicate, soft membranes which have the receptor organs for balancing and hearing are called as the membranous labyrinth. And this membranous labyrinth is housed into these canalicular parts of the temporal bone, and these are called as semicircular canals and the cochlear canal. The ducts basically, these are called as the bony labyrinth. So be clear about the things when we call as bony labyrinth, which is the outer house which houses the inner soft delicate structures, the membranous labyrinth. So we will see all these things one by one. So up to here, this is the extent for external ear, which includes the auricle and pinna and the external auditory canal. And then this much is the extent of the middle ear, which is quite smaller, and it is connected towards the external auditory meatus with the help of tympanic membrane. And this is the auditory tube. It is attached via the auditory tube into the nasopharynx. And on the other side, on the most inner aspect, medial aspect, it is attached. That means it communicates with the inner ear. So that is how three parts of the inner ear, external ear, middle ear, and inner ear are present. A similar diagram just to say, see, this is the cartilage of the pinna and this is the ear canal itself. So outer part is cartilaginous, inner part is bony, and here is a structure which we call as the tympanic membrane or the eardrum, which is actually is a barrier between the external auditory canal and the middle ear, so that the middle ear does not directly open into the external auditory canal. And that is why, because of the presence of this eardrum or tympanic membrane, the air particles, the dust, the insects, the water, fluid, anything cannot enter into our middle ear. This is for protection and magnification of the sounds which we receive through our auricle and extra-auditory canal. So, in patients in whose eardrum or tympanic membrane is being damaged or have hole in it because of some infection, some pus coming out of the middle ear, sometime if it has not healed completely, so there might be a hole in those persons' tympanic membrane, and that is how whenever they are taking bath or like in a swimming pool, the fluid from the extra-auditory canal may enter into the middle ear. And middle ear is a very precious space. It is a space which houses our ear ossicles, and these the first one is the malleus, then the incus, and then the stapes. And the malleus is attached over to the eardrum. So the sound which has been conducted by extra-auditory canal being magnified by the tympanic membrane is again being magnified or being diminished with the help of malleus, incus, or stapes according to the quality of the sound. And then stapes foot plate is added into the oval window of the inner ear labyrinth, bony labyrinth. So if there is some infection which travels either via the external auditory canal, via the hole or rupture or a gap in the tympanic membrane, or some infection might also travel through this eustachian tube. If you have a throat infection and this infection is being carried to the middle ear for long time and middle ear does not get aerated because it needs to be aerated, in that cases middle ear infection may occur, pus may be filled because of the inflammation of the mucous membrane of the middle ear, and then this infection is long standing and not being treated, then this may slowly ossicles might also get damaged and dissolved, and that will lead to a strong hearing loss in the patient. So we need to care about our middle ear so that it gets being aerated frequently. That is why whenever there is congestion in the throat, there is pharyngitis or throat congestion, inflammation, we do have a different we hear diminished sounds. That is because there is no aeration into the middle ear via the eustachian tube, because the opening gets congested and blocked because of inflammation. And when the infection goes down, veins off, this opening again gets opened up and we get a aerated middle ear again. So this is a common thing, and as soon as the congestion is over, again the aeration of the middle ear starts again. But if it is long term, very frequent, the aeration is being hampered into the middle ear, air is being not transmitted. And also we need the opening eustachian tube, because via the throat, when we are swallowing, there is a gush of air which is pushed into the middle ear, so that pressure, the air pressure within the middle ear is equal to the air pressure outside, that is in the external canal. That is why the eardrum can remain in equilibrium. If there is less pressure here and more pressure outside, then this pressure might push the tympanic membrane to protrude towards the middle ear. Okay, or if there is less pressure in the external canal and more pressure in the middle ear because of the excessive fluid might also create pressure in situations of infection. So that will push the eardrum towards the external canal, like this, convexity towards it. So in both the cases we hear a less clear sound. There may be little bit of the diminished sounds we may feel. So the tympanic membrane needs to be in equilibrium, and for that the pressure, air pressure on both sides, like on the external canal and on into the middle ear, needs to be equal. So, and this is the part of the bony labyrinth. Yeah, this black outline is the bony labyrinth. Yes. Yeah. And here is the okay. So they have cut that section and they have tried to show the equilibrium part and the hearing part. This I will discuss in detail. So let us come to the anatomy of the ear proper. In three main sections we will be studying: outer ear, middle ear and inner ear. I have explained most of the things to you. You will just be revising. This is the pinna part, this is the external auditory part and canal. Okay, so this much is the outer ear, which is also called as external ear. So what we see is the pinna. Okay, then middle ear, into which we will discuss the tympanic membrane or the eardrum, auditory ossicles, that is the malleus, incus and stapes. Then the middle ear cavity itself, having different walls and different openings, and the eustachian tube. Then in the inner ear we will see the oval window, the round window, the cochlea and the semicircular canals. So by this time, with the help of all those slides which I have already shown you, you people should be able to delineate that middle ear is related with all these things, inner ear has all these things, is related with these structures, outer ear consists of these structures. So that is the major gist. So let us come to the another slide. Auricle and pinna. So whatever you see from outside, that is a visible part of the ear, is auricle or pinna. It is composed of fibroelastic cartilage which is covered with skin. and the outer ridge of the auricle you see is the helix part, and the lower part into which we wear our earrings, that is called as a lobule, earlobe. That is the soft pliable part, because it does not have the underlying cartilage. It does have fat connective tissue covered by the skin, so it's very soft. Rest of the pinna, if you feel, just feel your pinna, and you will see that if you just cover it, or you can just move it in whatever direction you want, but it regains its shape. It is because of the elasticity present in it, because of the fibroelastic cartilage forming its underlying framework. Okay, and the lobule part does not have any firm structure underlying it. It's just a soft pliable part. You can just feel these structures over to you, and the resilience and elasticity of the cartilage you can very well feel. So this in the auricle, this is the helix part. Okay, you can make out all these things. This is the lobular part, this is the tragus, this is the crux of the helix. Helix goes like this, so cross of the helix, and this part inside it is the antihelix, the crura of the antihelix. Okay, and here is the concha, and here is the simba, cavum. So these are the structures you can make out, like antitragus and tragus. So just look into the mirror and just find out various parts of your auricle. You will be able to. Then we see an extra opening, the outer part, that is the lateral opening of the external canal, which goes inside. That is the ear canal itself, and it's approximately 1 inch long, S-shaped. The external canal is not just a straight tube, it is S-shaped, but in newborn babies and infants it is like a straight tube, and it's small also. So outer 1/3 part is surrounded by cartilage, means outer 1/3 part towards the pinna is cartilaginous, and inner 2/3 part is formed by the bone, that is a mastoid bone. So it allows air to warm before reaching tympanic membrane. It passes through this canal part, and it also isolates the tympanic membrane from physical damage also, because if the tympanic membrane would have been just here at the just adjacent to the pinna, so it would have been more prone for infection, for the dust, for the fluid, everything which is present in the outer environment. But because of the presence of this air canal, the air gets at least warmed up, and it has many hairs and many sticky substance called as cerumen. You must have seen. So cerumen is normal, and it is when the air is passed through these small hairs in the external canal filter that air, so that major dust particles are being prevented to reach up to the tympanic membrane. Similarly, the cerumen also is sticky and gets it entraps the particles from the air, and also it might entrap the insects also if some insect happen to be inside the external canal. So so nature has provided this external canal with a purpose, so that anything does not get into touch with our tympanic membrane, because tympanic membrane is a very delicate structure. It separates the middle ear from the inner external ear, and it has to be a softer structure. It cannot be very rigid like bone, because it would not fulfill our structures then. So that is the importance of external canal. Now coming on, after covering the pinna and external canal, coming on to the tympanic membrane, which is actually the intervening structure. One surface of the tympanic membrane lies towards the external canal, and one surface lies towards the internal auditory, towards the middle layer. So if you look with a otoscope, then and in a magnified view, you will be able to see such a pinkish whitish basically a structure, and you will see this projection. This is because of the handle of the malleus is attached over to the inner surface towards the middle layer onto the tympanic membrane. So the handle is inside, and what we are looking is from the outside, and we can just see the process and the handle have some impressions over to the tympanic membrane, which we can see from the outer surface. And there is an upper tensa part and this is a flaccid part and a tense part of the tympanic membrane. Tympanic membrane is basically made up of 3 layers: outer, inner, and middle one, which has various fibrous connective tissue structures. So this is formed up of these 3 layers, like epithelium, and middle one is a connective tissue layer. The outer layer is being formed by the epithelium of the external canal. The inner layer is being formed by the epithelium of the middle layer of the middle ear, and the middle layer in between the two is formed of a connective tissue layer. So it is actually a transition. It does not belong either to the completely to the middle ear, completely to the external ear. It is a transition, a barrier where the external ear enters into the middle ear. So that transition part is the tympanic membrane, or also called as eardrum, because the sound waves drums it like beats it like on a drum. So it acts as a drum for the eardrum. So it is a thin membrane, forms boundary between outer and middle ear, and it vibrates in response to sound waves, and it changes acoustical energy into mechanical energy. So whatever sound waves, the acoustic energy coming up to the tympanic membrane, and then those waves drum this over to this tympanic membrane, and then it is being converted into the mechanical energy. That means then this energy will be transmitted from malleus to the incus, then to the stapes, then to the oval window, then to the inner ear. And that is how in the inner ear there are receptors for hearing, and then these receptors sense this sound, and this information via the receptors is being carried out by our 8th cranial nerve, the vestibulocochlear nerve. So, and then this information is being reached up to the sensory cortex into our brain, and that is how then we interpret what is the sound. It is a female voice, is it a male voice, is a loud quality, is a high pitch or a low pitch, or is a quiet sound or a whisper sound, whatever. So that is how the whole system is being operating to understand the quality and the sound, what is being said to us. This is also the interpretation of the sound. So that is a complete sequence of events. So you can just have look over to the different parts of the tympanic membrane. So this is the lateral. Here is the posterior mallear fold, lateral process and handle of the malleus. This is the most prominent part, the umbo part. Here is a light reflection cone of light is present here, and this much part is the pars tensa, and here is the pars flaccida. So you can just go through your books and you can have this structure very with clarity, and this is how you see in an otoscope. These are the structures which we can see, and you can correlate with IEL, all this, the lateral process and the handle umbo lateral process, okay, and the pars tensa part, pars flaccida part, okay. So just go through it. Now coming on to the middle ear, and in middle ear is like a room. It has 6 walls. Like this is the roof. Number 2 is this is the floor part. This is the lateral wall towards the tympanic membrane, external ear, no? And this is towards the inner ear, and there is a posterior wall and anterior wall also. So like a room having 6 walls, the side walls, the four side walls. One is the roof and the floor. Similarly, the middle ear is situated like that, and we do have different structure onto different walls of the middle ear. And this is the malleus, this is incus, and this is stapes. So prominence of lateral this we will discuss one by one. So one is the roof is formed of the tegmental plate, the tegmental wall. Floor is formed of the jugular wall. The jugular bulb and wall are present in the floor. And number 3, lateral wall is the membranous because of the tympanic membrane. Medial wall is towards inner ear. It is called as a labyrinthine wall. And posterior wall is the mastoid wall. And anterior is the carotid wall, which has been removed to provide this wall. Here, what we see, if we cover this with a wall, we will close the room completely. That would be the anterior wall. Okay, so just imagine a room having all the 4 walls and 1 roof and 1 floor, and just correlate all these things. And with the help of a skull also we can do. So there are various openings into the middle ear which are important, and 1 or 2 openings you already know. So from external ear, external auditory meatus covered by tympanic membrane. So it has 1 opening, but this opening is covered by the tympanic membrane. From towards the side of inner ear, there is 1 oval window and 1 round window. So the oval window is being closed by the stapes foot plate, because the stapes foot plate fits here at the oval window and is covered by a membrane. In the round window, this is also covered by a membrane. Okay, then comes the anterior wall, that is the having the opening of the eustachian tube, and it has a direct opening into middle ear from the throat. And in the throat, it is actually from the nasopharynx part, and you might have seen, if you have seen the specimen in the throat, you will be able to memorize this. Just go through your books, or if I have a lecture taken over it, you can go through that lecture and you can just have a look over to the tympanic membrane, situation of the tympanic membrane in the pharynx. And its function is to equalize pressure in the middle ear with the environment. And then from the posterior wall, there is the opening of the mastoid sinuses, and this is located in the mastoid process of the temporal bone, and you all can feel your mastoid process. Just behind your pinna, you can see a bony prominence, and you can just see this is your mastoid process, and it has many mastoid ear cells over there, and these are connected to the posterior wall of the middle ear. And also these are direct openings. So the direct opening means they open directly without an intervening membrane. But the oval window, round window, and the tympanic membrane, these are openings which are covered by the membranes. But from the eustachian tube and from the mastoid sinuses, these are the direct openings, not covered with any of the membrane, and that is how they help in maintaining the ear pressure, aeration of the middle ear, as well as mastoid sinuses. If the middle ear gets infected and the eustachian tube gets blocked, along with the middle ear, there will be infection in the mastoid air cells also, sinuses also, because these air sinuses also need to be aerated. You must be knowing that now, that there are paranasal air sinuses like frontal air sinuses and maxillary air sinuses, sphenoidal air sinuses, ethmoidal air sinuses. Those lie in the vicinity of nasal cavity, and from the nasal cavity those sinuses get aerated, because the air sinuses are formed for the air to be housed within them. So these bones have some cavities in them, and these cavities have air, and they provide resonance and they have different functions, but they needs to be aerated. If there is block or congestion or infection or cold in the nasal cavity, these openings get blocked and these sinuses might get infected. And that is how we say that, oh, this is patient is having a sinusitis, means acute inflammation of the sinuses. And if it happens recurrent, that becomes a chronic thing, and then we say that this is a chronic sinusitis. So all our air sinuses needs to be aerated. Similarly, the mastoid process has mastoid air cells and it needs to be aerated, but this is not aerated with the help of the nasal cavity because it does not lie in the vicinity of nasal cavity and it does not have its opening into the nasal cavity. Instead, it has its opening into the middle ear, and the middle ear is being aerated via the help of eustachian tube. So that is why whenever there is a throat infection or congestion in the throat or pharyngitis, as in cold and cough we do often feel, if it is long standing middle ear aeration doesn't happen, then mastoid air sinuses infection may also take place because there is no aeration and stagnation of the inflammatory cells occur there and causes pus to be accumulated over there, and that becomes infective also. So that is the importance of being aerated. So these are the different openings into the middle ear. You should be knowing about these openings and their importance. Now coming on to the ossicular chain, and you must have already heard of these ossicles many times: malleus, incus and stapes. And this is how the malleus, the handle of the malleus and the processes are being, and this is how the incus is being present, and that is how the stapes is being present, and this is the foot plate of the stapes. So the ossicles are the smallest bones in our body. They act as a lever system, and foot plate of stapes enters the oval window of the cochlea. So these are, so whenever you see, this is how these bones appear. Actual bones appear like this. The stapes, which is also called as stirrup, is the smallest bone of the body. So after the ossicles, just coming on to the tympanic muscles, and that must be surprising for you people because you might be thinking, is there any muscles inside the ear? Yes, there are two muscles inside the tympanic cavity. Actually, tympanic cavity is the word which is used for the middle ear cavity. Okay, so tympanum is the middle ear, and tympanic cavity means cavity of the tympanum, cavity of the middle ear. So there is one muscle named as the tensor tympani muscle, another muscle named as the stapedius muscle. As the name suggests, tensor tympani muscle stretches the tympanic membrane, means it tenses the tympana. तो tympanic membrane को tense करती है. It lies in the bony canal above the eustachian tube and is attached to the handle of the malleus. Okay. And the another muscle is stapedius muscle, which arises from the posterior wall of the tympanic cavity and is attached to the head of the stapes by a cylinder tendon. Stapedius, as the name implies, it gets attached over to the stapes, head of the stapes. So the tensor tympani is innervated by a branch of trigeminal nerve, and the stapedius muscle is a branch from the facial nerve. If there is facial nerve damage, stapedius muscle would be paralyzed, and its function is just to keep the stapes foot plate stretched out and not hammering too loudly over to the oval window. Suppose there is a very loud sound, and because of this loud sound, our inner ear receptors may get damaged because of the high acoustic energy. In these kind of situations, the stapedius muscle contracts and it holds the stapes so that stapes does not hammer onto the oval window so loudly to damage the inner ear. So that is how our stapedius muscle comes into action and its importance. But if there is facial nerve paralysis, stapedius muscle won't do its function, and some sounds might be very hurting or damaging for our ear. Okay, and similarly the tensor tympani tenses our tympanic membrane. So both these muscles are important and they are supplied by their corresponding nerves. Now coming on to the Eustachian tube, let us just have a look. The Eustachian tube is lined with mucous membrane, connects middle ear to the back of the throat, and it equalizes air pressure, normally closed except during yawning or swallowing. So, and it's not a part of the hearing process. It does not play a role of the hearing process, but it does equalizes the pressure and keeps the middle ear aerated and healthy. And when the air pressure is equalized, we hear optimally. So for the optimal function of the middle ear, this Eustachian tube and its importance lies there. Okay, so you must have felt that during yawning or swallowing we feel a difference in the hearing quality, and that is because of the sudden gush of air being passed into the middle ear during these, because it gets opened up during the yawning and swallowing thing, eating thing. So that is why it is also recommended that in whenever we are traveling via air, so at heights, or especially when the plane is landing or taking off, there is sudden changes in the air pressure. Though the aircraft have its air pressure maintained chamber, but still we feel some sort of pain or some discomfort. So people are advised just to have a candy or something like that, so that you can just keep on swallowing or chewing that candy's saliva mixed thing, and your Eustachian tube gets open close frequently, and it keep equalizing the air pressure from the external ear towards in the middle ear, so that both side air pressure are equal. So that's the importance of Eustachian tube. Now coming on to the inner ear, that is a labyrinth. And inner ear, as I have already explained, that it has a bony labyrinth, which is a bony house for the membranous labyrinth made up of membranes. So in the temporal bone and inner ear, you can see a correlation. Whenever we see, you can see this is the skull and this is the part of the temporal bone where our inner ear lies. So if this part of the bone is being removed, and we see that there are some bony structures which are being formed inside this temporal bone, and these are here is a spiral like structure, the cochlea, and here is a canalicular 90-degree arranged at 90 degrees to each other. This is the semicircular structures. So this is the bony labyrinth, and we will see the details of this bony labyrinth, what lies inside this bony labyrinth. So in the bony part, you can see there are 3 semicircular canals, and here is the spiral structure, the cochlea, and you can see the middle structure is called as the vestibule. Okay, vestibular part, and this is the oval window, and here is the round window. Okay, and these are the structures which lies within this bony labyrinth. So you can see here, these are the semicircular ducts. These are the ducts. These are the canals. And here, this is the cochlear membrane. And these are the nerve endings. This is the vestibular part of the vestibulocochlear nerve, the 8th nerve. And this is the hearing part, the cochlear part of the vestibulocochlear nerve. And from the receptors present here in this membranous labyrinth, the fibers gets arranged towards the main trunk of the 12th nerve. Here is the cochlear fibers. Both of these fibers get nearer to each other to form a single nerve, which is carrying the cochlear fibers also and the vestibular fibers also. That is why we should not be just saying like that ki auditory nerve or the vestibular nerve. This nerve has both the fibers, so that is why I insist on naming it properly, because it has both the fibers. So the 8th nerve, always call it as the vestibulocochlear nerve. And you can just go through this. This is the posterior semicircular canal, this is lateral semicircular canal, this is anterior, and all of three are arranged 90 degrees to each other. Then here are the ampullae, and this part is the vestibule, and this is called as the cochlea, and this is cupula of the cochlea. Here is the oval window, here is the round window. Same structure similarly. You can just see that here is the tympanic, this is the middle ear cavity, the tympanic cavity, and then this blue structure is actually the bony labyrinth, the dark blue, and the light blue structure is the membranous labyrinth, which is housed in its membranous labyrinth. So that is how these semicircular ducts are being arranged, and their expanded ends are called as the ampullae. And here are the two structures, the utricle saccule, and this is the endolymphatic sac. And in previous classes also, like in 11th-12th, you must have read about all these things. Just go through these. So within the bony labyrinth is the membranous labyrinth, and it is filled with endolymph. Okay, so the membranous labyrinth, the membrane-like structure, is filled with some fluid, and this fluid is called as endolymph. And one of the membrane structure is the cochlea, which is a snail shell. This is responsible for hearing, and the other structures responsible for balancing consist of three parts. So for hearing, only one structure, the cochlea, and for balancing there are three parts: the semicircular canals, the utricle, and the saccule. So if you just have a look over to it, they have cut a part of the bony labyrinth, and they are showing the cochlear duct. Okay, so this is the cochlear duct itself, and this blue colored thing which is housed within the bony labyrinth. And you can see this cochlear duct traveling here. And similarly, these are the semicircular ducts filled with a fluid, the endolymph. And you can see this expanded structure is utricle, and adjacent to it lies the saccule. And this is the opening of oval window and round window. So that is how when oval window foot plate strikes over to here, the information is being carried like this, and then this perilymph starts, and that is how this fluid motion comes up to the round window, and from round window then it again goes like that. So that is how the function of various limbs. So endolymph is located within the membranous labyrinth, and perilymph is located between membranous and bony labyrinth. So there is also another fluid, means surrounding this membranous structure, outside this is the perilymph. So perilymph is located between the membranous and the bony labyrinth. Okay, so you can just have endolymph, the perilymph, you can just delineate these. Coming off to the cochlea, the cochlea resembles a snail shell, 2 into 3 by 4 turns of a bony column. It occupies, it spirals like that, and within the cochlea there are 3 canals. Okay, so from the bony structure, and there are some membranous extensions which divide this canal further into 3 parts: scala vestibuli, tympani, and media. You can just have a look. This part is the scala tympani, middle is the scala media, and upper one is the scala vestibuli. Over to the vestibuli, there is a Risner's membrane, over to the spiral. There is organ of corti in between the media and the skeleton penni. So this is the spiral lamina, and here is the spiral organ of corti which is being present, and here is the presence of main hair cells and the supporting hair cells, and which actually the main hair cells actually act as the receptors for hearing. So these hair cells are very important. If there is disease which destroy these hair cells or these receptors, then there will be difficulty in hearing or diminished hearing or deafness. So these are the structures again shown. Just go through these diagrams and you can just have a better orientation. And this is how the organ of corti is being situated. So here is the basal membrane, which is called as the basilar membrane, and here you can see these are the outer hair cells and some hairs towards the inside the inner hair cells, and other cells are the supporting cells like cells of Henson, cells of Claudius, cells of Titus, pillar cells. Okay, and from these the outer and inner hair cells, these are the principal cells, and these nerve fibers are being carried towards the cochlear part of the vestibulocochlear nerve for the formation of a nerve. And these hair cells have projections which touch the tectorial membrane overlying this organ of corti. So this whole structure of the supporting cells and outer and inner hair principal cells is the organ of corti, and this is the structure of whole of the organ of corti, which is actually act as a unit for the reception of the hearing. So just understand the mechanism, how sound travels through the ear, and we get and then we interpret the sound. So acoustic energy in the form of sound waves is channeled into the ear canal by the pinna. So that is why the pinna has a shape like this. And you must have observed that elephant does have such big ear pinnas, so that they have a good hearing, since they can collect the waves, sound waves from a larger surface area, and so they are having good hearing capability because the pinna collects the airwaves. So that is why there is a need for pinna. Then sound waves hit the tympanic membrane after passing through the external auditory canal and then cause it to vibrate like a drum, then changing it into a mechanical energy. Then from the tympanic membrane, the malleus, which is attached to the tympanic membrane, start ossicles into motion. Every ossicle gets into motion, and then the stapes moves in and out of the oval window of the cochlea, creating a fluid motion of the perilymph and then the antrolymph. The fluid movement causes membranes in the organ of corti to shear against the hair cells. So fluid motion causes these hair cell movements and they shear against the organ of corti, and this creates an electrical signal which is into the hair cells and which is sent up to the auditory, now to the brain. So they have used the word auditory because it is only the auditory part of the vestibulocochlear nerve. And then this information from the auditory part of the vestibulocochlear nerve then is being goes into the sensory cortex, and then the brain interprets it as sound. So, and we have different hearing areas in our brain. Now coming on to the sense of equilibrium. Equilibrium means maintaining our posture and our body stability in different situation of movements. So position changes of the head. So the stimulus for maintaining the sense of equilibrium is head position. Position changes of the head sets in motion the fluid of the inner ear. So whenever we change a position from left to right, right to left, down and up movements of the neck, the head position changes. Then there is some fluid in the semicircular canals and which sets into motion and do some changes. So the equilibrium receptors which are present in utricle and saccule You must have already seen this. Here is the utricular macula and here is the saccular macula. This is a semicircular canal, and here at the ampulla are the receptors, and then the utricle and saccule in eventually senses these changes. So they are most important. Static means stationary or linear equilibrium. So when we are moving forward, backward, from side to side, so that is the static or linear equilibrium. Okay, and there is another equilibrium which is maintained by the semicircular canals, that is the angular. Whenever you are rotating like this with the angular motion, then our semicircular canals, they have a fluid motion and they are responsible for these equilibrium receptors, and they are basically important for the dynamic or angular equilibrium. So utricle and saccule are responsible for the static and linear equilibrium, while the semicircular canals are responsible for the angular equilibrium. So we both of these structures are important as per the need of the body. That is how our body is being kept into equilibrium in different positions, in different motions also. So the conduction of nerve impulses along cranial nerve 8 to cerebellum and skeletal muscle. So what happens whenever the sensory organs like the semicircular canals, utricle and saccule, they take in information. This information is being carried to the sensory cortex of the brain, and some fibers send this information to the cerebellum also. And from sensory cortex, information is being sent to the motor cortex, and motor cortex then interprets this information, and then it sends its information to the cerebellum and to the muscles of the body. And here the cerebellum is the seat for balancing all these inputs and output responses, like how much muscle tone has to be there, how much motion is being tolerable, and how we maintain our balance is with the help of the cerebellum also. If cerebellar function is not intact, we would not be able to maintain our posture, equilibrium and balance. So cerebellum is very important for maintaining equilibrium and posture. And it also give information to the muscles, so that the muscles get toned, get ready, so that we can balance. If we are going to fall, our leg muscles and our trunk muscle just get hold of us and they won't let us fall. So that is how muscle toning and action of muscle at that particular moment when we are going to fall or we are going to lose our balance, it is important. So that is how the circuit works upon with the help of brain and the cerebellum, and with the output to the muscles, and input is went through the sensory organs which we have discussed. The auditory is the cochlea, and the balancing thing is via the semicircular canal and utricle and saccule. So that is how our membranous labyrinth is important. And now lastly, coming on to the arterial supply, there is a labyrinthine artery supplying the inner ear, which is an end artery and branch of the basilar artery. So in the brain you must have seen that the two vertebral artery from both sides join to form a basilar artery, and then labyrinthine artery is one of the branch which travels towards the both sides of the inner ear. And artery means it does not have any anastomotic channels. If it gets blocked, that area will be damaged. That is what we mean by an end artery. So there are some clinical things, like if there is an infection of the extra-auditory canal, that is called as otitis externa. So sometimes you must have seen that there is some tender inflammation, damage, which is like tender and weeping meatus बोलते हैं उसको, means that there is inflammation of the skin and lining the extra-auditory canal. It is very painful, and it creates more pain because the cartilaginous, whenever there is skin over the cartilage does not give much space for the inflammatory fluid to collect, and that becomes a tense space and causes extreme pain. and if not treated, it can become chronic and can lead to meningitis, mastoiditis, labyrinthitis, and other complications, because nearby all these structures lying over there, so needs to be treated. And there is an entity you must have heard of: deafness. Deafness means loss of hearing. That means it may be diminished or very much loss of hearing. And the loss of hearing is of two types: conductive hearing loss and sensory neural hearing loss. The conductive hearing loss means when there is block in the conduction pathway, the sound waves, the mechanical energy being conducted through different steps from the external ear via the tympanic membrane to the middle ear via the ossicles, then to the inner ear. So if there is any block or damage or discontinuation of this pathway of conduction, that will lead to conductive hearing loss. While there is sensory neural hearing loss, when there is some difficulty in the processing of the sound. Conduction is okay, but the receptors are not working properly, or there's nerve damage, nerve fibers are being damaged, or and the pathway from the receptor organs up to the brain, and it is not being processed properly, or some discontinuation of that pathway, some neuronal tumor or some disease of the nerves, that would lead to the sensory neural hearing loss. So I have already told you conductive and sensory neural hearing loss are two types of hearing loss, and in some patients there might be some conductive as well as sensory neural, that would be called as mixed. And centralist problem lies in the central nervous system itself. If there is the sensory cortex or the hearing areas of the brain are not working properly, some neuronal damage is there, that would be a central hearing loss. There is an entity which you might heard during course of your clinical postings called as a otosclerosis. And otosclerosis is a deposition of sclerous material around the foot plate of specifically around the foot plate of the steps, and this sclerotic material eventually dissolve the foot plate of the steps, and that will lead to the conductive type of hearing loss. There is an entity called as Meniere's disease, in which the endolymphatic sac, normal endolymph is this much in amount, and if there is excessive endolymphatic formation, that membranous labyrinth becomes distended with the excessive endolymph, and this causes swelling and pressure onto the nerves, which leads to recurrent attacks of dizziness, nausea, vomiting, ringing in the ears, and gradual nerve deafness may occur. This entity is called as Meniere's disease. So this is for ENT specialists. And presbycusis means there is gradual hearing loss with aging due to gradual loss of hair cells and neurons, and that is a normal part of the growth and aging process. And with old age it happens more or less with everyone, and that is called as presbycusis. So this is a physiological thing which happens. And so students, thank you very much, and keep studying and keep reading.